The Quantum R trial took patients with relapsed or refractory FLT3-ITD mutated AML and randomized them 2-to-1 to receive either Quizartinib, a potent FLT3 inhibitor, or conventional salvage chemotherapy. And that resulted in an overall survival benefit for patients randomized to get Quizartinib. One of the features of the responses that we see in patients treated with Quizartinib is not a classic complete response by International Working Group criteria. And in fact, they're commonly what we call a CRI or a complete response with incomplete count recovery. And the purpose of this study was to assess was there a meaningful clinical benefit for those patients. So just because you got a CRI, maybe you were still sick and you didn't really benefit from that. And so this study looked at transfusion independence, which is one of the parameters that regulatory agencies have been looking at for drug approvals. Okay, if you don't get a response, or if you have this funny response, does the patient at least benefit by not needing to come in and get transfusion? So we specifically looked at transfusion independence, and we found that patients who responded to Quizartinib did actually convert from transfusion dependence, pre-treatment, to transfusion independence at a rate of about 21%. So about 1 in 5 patients actually no longer needed transfusions associated with having a CR incomplete or whatever. So this was just a sign of tangible benefit to the patient beyond survival, which actually the trial also did show. So that was really the take-home message, is that there was more tangible benefit to the patient than just our labeling it a response.